Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing an antibiotic that goes by the name of Azithromycin. Its brand name is Zithromax. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So azithromycin works by binding to the 50S subunit in susceptible microorganisms. This would interfere with microbial protein synthesis with the goal of destroying the bacteria. So there are many different indications for azithromycin, so I'll just list off some of the common ones here for you now. It can be used to treat acute infective exacerbations of COPD or chronic obstructive pulmonary disorder. It can be used to treat acute otitis media, which would be an ear infection. We see it used in bacterial conjunctivitis, as well as bacterial sinusitis. It can be used to treat community-acquired pneumonia, as well as gonorrhea. It can be used to treat uncomplicated infections of the skin or of the subcutaneous tissue. It can be used to treat urethritis and cervicitis. It's seen prescribed to treat pelvic inflammatory disease. And as an alternative to first-line therapy, it can be used to treat streptococcal pharyngitis, as well as streptococcal tonsillitis. Now, before somebody was to use azithromycin or Zithromax, there are some contraindications they must clear, as well as some precautions and warnings they should be made aware of. It's contraindicated in individuals who have experienced cholestatic jaundice after receiving azithromycin therapy in the past. It would also be contraindicated in patients who have had hepatic dysfunction with prior azithromycin therapy as well. It's also contraindicated in patients who have a hypersensitivity to azithromycin as well as erythromycin or other macrolide and ketolide antibiotics. Now, in terms of precautions, it should be noted that QT prolongation has been seen in patients receiving azithromycin therapy. We would try to avoid class 1A as well as class 3 antiarrhythmic agents, as this would put the patient at an increased risk of QT prolongation as well. Localized IV site reactions have been reported. These are more common when the concentration is higher, so especially when it's above 2 milligrams per mil. There is a risk of hepatotoxicity with azithromycin, and as well, patients who have hepatic impairment must use this medication cautiously, as it is generally handled by the liver. Serious and sometimes fatal allergic reactions have occurred, including angioedema, anaphylaxis, as well as dermatological conditions such as DRESS, Stevens-Johnson syndrome, as well as toxic epidermal necrolysis. New onset or exacerbation of myasthenia gravis has been reported. And finally, just to note here that if somebody is using this medication to treat bacterial conjunctivitis, they should avoid wearing their contact lenses. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start using azithromycin, the dose that they use would depend on the reason that they're using the medication. If somebody is using azithromycin to treat their COPD, typically they could use 500 milligrams once daily for 3 days. Alternatively, they could take 500 milligrams on day 1 and then use 250 milligrams on days 2 through 5. When somebody is using the 1% solution to treat bacterial conjunctivitis, they would instill 1 drop into the affected eye twice daily, and they would want to make sure that these doses are separated by 8 to 12 hours. They would do this for 2 days, followed by using just 1 drop once a day for 5 days. If somebody is treating chlamydia, they can use 1 gram of azithromycin as a single dose. When somebody is treating gonorrhea, you would typically give that same 1 gram of azithromycin as a single dose, and as well, you would give ceftriaxone 250 milligram as an intramuscular injection. And finally, if somebody is using azithromycin to treat traveler's diarrhea, they could just take 1 gram as one single dose, or alternatively, they could use 500 milligrams once a day for 3 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using azithromycin, so I'll list some of those off here for you now. Anywhere from 3 to 7% of people that receive this medication by injection do have an injection site reaction. Anywhere from 2 to 14% of patients using azithromycin experience gastrointestinal pain. 4 to 12% may experience diarrhea. Flatulence is seen in 5% of patients, and nausea in 3 to 14%. And vomiting can happen in up to 13% of patients. Some people may experience an increase in liver enzymes. This would typically happen to 1 to 6% of people. Headaches, as well as abnormal vision, happens 5% of the time. We mentioned in the precaution section that it can cause QT prolongation, as well as those serious dermatological conditions. Azithromycin may cause congenital hypertrophic pyloric stenosis. Hepatitis has been seen in less than 1% of patients receiving this medication. Hepatic necrosis, as well as liver failure, are also possibilities. And finally, less than 1% experience corneal erosion. That's all we're going to talk about today with Azithromycin or Zithromax. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you're willing to help me grow this channel, you can like the videos, share the videos, as well as subscribe to the YouTube channel. There's also some links in the description you can check out as well. All right, that's it for today. Take care.